Everyone. Thanks for joining the 2025 Qualified Clinical Data Registry and Qualified Self-Registry Self-Nomination and QCDR Measure Submission Demonstration. During today's webinar, CMS subject matter experts will provide information on the QCDR and Qualified Registry Self-Nomination process for the 2025 MIPS performance period. This webinar will also include a walkthrough demonstration of the QCDR and Qualified Registry self-nomination forms available on the QPP website, as well as the QCDR measure submission form for those submitting QCDR measures. The presentation will then be followed by a question and answer session where attendees will have an opportunity to ask questions via the phone and through the Q&A box. And CMS subject matter experts will address as many questions as time allows. If you don't catch everything during today's webinar, don't worry. A slide deck and recording from today's session will be posted to the QPP webinar library within a few weeks. Also, there will be a part 2 for today's webinar. On August 22nd, we'll host a virtual office hour session for the self-nomination application process. So if we aren't able to get to your question today, we encourage you to join us for that. With that said, I'll now turn it over to Dr. John McGuire to get us started. Dr. McGuire?
Thanks, Haley. Yeah, hi, my name is John McGuire, and I'm a medical officer with the Practice Improvement and Measures Management Support, or otherwise known as PIMS team. We support CMS with the QCDR and Qualified Registry self-nomination and the QCDR measure submission process. On behalf of CMS, I'd like to welcome you all to today's webinar. So the purpose today is to provide an overview of the QCDR and Qualified Registry self-nomination and QCDR measure submission process for the 2025 Merit-Based Incentive Payment System performance period. This demonstration today will provide a walkthrough of the QCDR and Qualified Registry self-nomination form available on the QPP website, as well as the QCDR measure submission form for those submitting QCDR measures for consideration. As Hallie said, we will wrap up with a Q&A session as time allows. We ask that you keep your questions focused on QCDR and Qualified Registry self-nomination and measure submission related items. Other policy questions we will prefer to defer to another time. You can always submit those through the QPP Service Center as questions, and or also you can review the QPP Resource Library for additional information. So I'm going to hand off now to Hector with our PIMS team to begin the presentation. Thank you.
Thanks, Dr. McGuire. So like Dr. McGuire said, I'll go over some self-nomination information. Next slide. Organizations that want to participate as a CMS approved QCDR or Qualified Registry for the 2025 MIPS performance period must self-nominate and successfully complete a qualification process. Eligible clinicians, groups, vulture groups, subgroups, and APM entities that want to report the 2025 MIPS performance period via the QCDR or Qualified Registry reporting mechanism don't need to nominate themselves. Only intermediaries that want to participate and who meet the requirements of the QCDR or Qualified Registry need to complete the self-nomination form. As noted on the right side of the slide and of other slides during this presentation, the 2025 self-nomination period opens on July 1st and closes on September 3rd. Outside of the demonstration, interested organizations may download the 2025 self-nomination toolkit for QCDRs and Qualified Registries on the QPP Resource Library to learn more about the QCDR and Qualified Registry self-nomination process. An additional self-nomination webinar is scheduled for August 22nd, as Haley mentioned, from 1 to 2:30 p.m. Eastern, so interested organizations can have an opportunity to ask questions related to the 2025 self-nomination for QCDRs and Qualified Registries and or the QCDR measure submission process. Next slide. The Quality Payment Program website, including the self-nomination form, uses the HARP system for credential management. Organizations may register for a HARP account or log into the QPP website. Next slide. Now I'll go over some QCDR to qualify registry requirements. Next slide. MIPS data may be submitted on behalf of a MIPS eligible clinician, group, culture group, subgroup, or APM entity by any of the following third-party intermediaries. QCDR, qualified registry, before the calendar year 2025 performance period or 2027 payment year by health IT vendor, and a CMS approved survey vendor. Due to circumstances in which health IT vendors have submitted data that are inaccurate and unusable, and to ensure consistent requirements such as the data validation and auditing across all third-party intermediaries, we have finalized to eliminate the health IT vendor category beginning with the calendar year 2025 performance period. Health IT vendors will still be able to participate in MIPS as third-party intermediaries by self-nominating to become a QCDR or qualified registry if applicable requirements are met. They can also continue to facilitate data submission by assisting clinicians with submitting their own data directly. Next slide. A QCDR is defined as an entity that demonstrates clinical expertise in medicine. Thank you. Clinical expertise in medicine and quality measurement development that collects medical or clinical data on behalf of a MIPS eligible clinician for the purposes of patient and disease tracking to foster improvement in the quality of care provided to patients. A QCDR may include an entity with clinical expertise in medicine. Clinicians are on staff with the organization and lend their clinical expertise in the work carried out by the organization as a QCDR. An entity with standalone quality measurement development expertise. An entity that uses an external organization for purposes of data collection, calculation, or transmission may meet the definition of QCDR, as long as the entity has a signed written agreement that specifically details the responsibilities of the entity and the external organization. The written agreement must be effective as of September 1st of the year preceding the applicable performance period. Entities without clinical expertise in medicine and quality measure development that want to become a QCDR may collaborate with the entities with such expertise. As an alternative to becoming a QCDR, entities may seek to qualify as another type of third-party intermediary, such as a qualified registry. A qualified registry doesn't require quality measurement development experience. A QCDR may self-nominate up to 30 quality measures not in the annual list of MIPS quality measures. QCDRs will need to provide full QCDR measure specifications to CMS at the time of self-nomination. CMS will review the quality measures and determine if they're appropriate for QCDR reporting. Next slide. A qualified registry is a data intermediary that collects MIPS data from MIPS eligible clinicians and submits it to CMS on their behalf. Clinicians work directly with their chosen qualified registry to submit data on the measures or activities they've selected. If the entity seeking to qualify as a qualified registry uses an external organization for purposes of data collection, calculation, or transmission, it must have a signed written agreement with external organizations that specifically details the responsibilities of the entity and the external organization. The written agreement must be effective as of September 1st of the year preceding the applicable performance period. Qualified registries may not support QCDR measures. Next slide. CMS-approved QCDRs and qualified registries are required to comply with all requirements set forth by the Medicare Physician Fee Schedule Final Rule in detail within the 2025 self-nomination fact sheet and the 2025 qualified registry self-nomination fact sheet located within the 2025 self-nomination toolkit for QCDRs and qualified registries. These QCDR and qualified registry requirements are detailed on the upcoming slides. Next slide. QCDRs and qualified registries must support the quality, improvement activities, and promoting interoperability performance categories. QCDRs and qualified registries may be accepted from this requirement for promoting interoperability if its MIPS eligible clinicians, groups, and virtual groups are eligible for reweighting. They must support MVPs that are applicable to the MVP participant on whose behalf they submit MIPS data. QCDRs and qualified registries may also support the APP. A QCDR or qualified registry may support all measures and activities included in the MVP with the following exceptions. If an MVP is intended for reporting for multiple specialties, A QCDR or qualified registry are required to report those measures pertinent to the specialty of its MIPS eligible clinicians. Only the measure owner is required to report QCDR measures within an MVP. Must support subgroup reporting as well. Support for the performance categories, measure, and activities listed on the qualified posting for the entire MIPS performance period and corresponding submission period. Withdrawal mid-performance period for any reason is unacceptable and will result in the termination of your organization as a third-party intermediary. Next slide. Must have at least 25 participants by January 1st of the year prior to the applicable performance period, January 1st, 2024 for consideration for the calendar year 2025 performance period. These participants aren't required to use the QCDR or qualified registry to report MIPS data to CMS, but they must submit data to the intermediary for quality improvement. Be operational by January 1st of the performance period to accept and retain data to allow clinicians to begin their data collection on January 1st of the performance period. A system that isn't live beginning with the start of the performance period is considered non-compliant with this requirement. Must also support the performance categories, measures, and activities listed on the qualified posting for the entire MIPS performance period and corresponding submission period. Next slide. Must also submit data via CMS specified secure method for data submission, such as the QPP data format. Additional information regarding data submission methodologies can be found in the developer tool on the QPP website. Must also submit data on behalf of all payer data and not just Medicare Part B claims patients. Retain for the purposes of MIPS all records or data for 6 years from the end of the MIPS performance period, and comply with any CMS request to review your submitted data for the purposes of auditing. CMS may request any records or data retained for the purposes of MIPS for up to 6 years from the end of the MIPS performance period. QCDRs and qualified registries must provide CMS access to review the Medicare beneficiary data on which 2025 MIPS submissions are based, or provide to CMS a copy of the actual data if requested for validation purposes. Next slide. Must enter into appropriate business associate agreements with MIPS eligible clinicians, and that they must maintain records of their authorization to submit data to CMS for the purpose of MIPS participation for each NPI whom they submit data to CMS for. The records must be annually obtained, be signed by an eligible clinician or by an authorized representative of the reporting group, and records of the authorization must be maintained for 6 years after the performance period ends. Business associate agreements, you must obtain and keep on file signed documentation that each holder of an NPI has authorized the QCDR or qualified registry to submit quality measure results, improvement activities, measures, and activity results, promoting active results, and numerator and denominator data for patient-specific data on Medicare and non-Medicare beneficiaries to CMS for the purpose of MIPS participation. This documentation should be obtained at the time the clinician or group enters into an agreement with the QCDR or qualified registry to submit MIPS data to the QCDR or qualified registry, and must meet the requirements of any applicable laws, regulations, and contractual business associate agreements. Groups participating in MIPS via a QCDR or qualified registry may have their group's duly authorized representative grant permission to the QCDR or qualified registry to submit their data to us. If submitting as a group, each individual clinician doesn't need to grant their individual permission to the QCDR or qualified registry to submit their data to CMS. Business associate agreements must comply with HIPAA, privacy, and security rules. For clinician consent, QCDRs and qualified registries must obtain signed documentation to indicate each client has authorized the QCDR or qualified registry to submit their data to CMS for the purpose of MIPS participation. BAAs must be a legally signed and dated document that address all aspects of the above requirement. Documentation for legacy programs and or out-of-date documentation does not substantiate that the necessary agreements are in place. Either electronic or written is acceptable to CMS, providing that electronic signatures or authorizations are legal in your jurisdiction. Next slide. QCDRs and qualified registries are required to provide performance category feedback on all performance categories supported at least 4 times a year and provide specific feedback to all clinicians, groups, wheelchair groups, and APM entities, including Shared Savings Program ACOs, on how they compare to other clinician groups, virtual groups, and APM entities, including Shared Savings Program ACOs, who have submitted data on a given measure and activity for traditional MIPS, MVPs, and the APP. CMS doesn't provide a template for the performance feedback reports. If a real-time feedback dashboard is available to the clinicians, CMS asks that the QCDR or qualified registry email clinicians, groups, wheelchair groups, and APM entities, including Shared Savings Program ACOs, at least 4 times per year to remind them that the feedback is available. Exception to this requirement may occur if the QCDR or qualified registry doesn't receive the data from their clinician until the end of the performance period. QCDRs and qualified registries must certify that all data submissions to CMS on behalf of MIPS eligible clinicians, groups, wheelchair groups, and APM entities, including Shared Savings Program ACOs, inclusive of voluntary and opt-in participants, are true, accurate, and complete to the best of their knowledge. This certification applies to data submissions based on the acceptance of data exports directly from electronic health records or other data sources, and for traditional MIPS, MVPs, and the APP. If you become aware that any submitted information isn't true, accurate, or complete, corrected information may be submitted until the end of the data submission period. If false, inaccurate, or incomplete data are identified after the data submission period, you should immediately notify CMS. Next slide. During self-nomination, QCDRs and qualified registries submitted a data validation strategy for CMS review and approval that thoroughly explained the validation process of quality, improving activity, and promoting interoperability data submitted to CMS. The QCDR or qualified registry must conduct a data validation for the payment year prior to submitting any data for that payment year to CMS for purposes of the MIPS program. The QCDR or qualified registry must conduct data validation and data for each performance category for which it will submit data, including, if applicable, to the quality improvement activities and promoting interoperability performance categories. The QCDR or qualified registry must conduct data validation and data for each submitter type for which it will submit data, including MIPS eligible clinicians, groups, virtual groups, subgroups, APM entities, including Shared Savings Program ACOs, voluntary participants, and opt-in participants, if applicable. The QCDR or qualified registry must use clinical documentation provided by the clinicians they are submitting data for to validate that the action or outcome measured actually occurred and was performed. Next slide. Data validation must include verification of the eligibility status of each individual clinician group, of each eligible clinician, group, virtual group, subgroup, opt-in participant, and voluntary participant. Eligible clinician, group, virtual group, subgroup, opt-in participant, and voluntary participant verification is insufficient. Verification of the accuracy of TINs and NPIs. Eligible clinician group, virtual group, subgroup, opt-in participant, and voluntary participant verification is insufficient. Calculation of reporting and performance rates. Verification that only the MIPS quality measures and QCDR measures, improvement activities, and promoting interoperability measures that are relevant to the performance period will be used for MIPS submission. Completion of a data validation audit. The QCDR or qualified registry must conduct each data validation audit using a sampling methodology that meets the following requirements. Uses a sample size of at least 3% of a combination of the individual MIPS eligible group clinicians, groups, wheelchair groups, subgroups, and APM entities for which the QCDR or qualified registry will submit data to CMS, except that the sample size may be no fewer than a combination of 10 individual clinicians, groups, wheelchair groups, subgroups, or APM entities, no more than a combination of 50 individual clinicians, groups, wheelchair groups, subgroups, and APM entities. To clarify this further, if you're submitting for individual clinicians, groups, and APM entities for 2025, that means that your data validation sample must include individual clinicians, groups, and APM entities. It cannot only have individual clinicians or groups or APM entities. You must have your combination for your data validation sample must include at least representation from each of the submission types that you're submitting data for. Also, uses a sample that includes at least 25% of the patients of each individual clinician, group, virtual group, subgroup, or APM entity in the sample, except that the sample for each individual clinician group, virtual group, subgroup, or APM entity must include a minimum of 5 patients and need not include more than 50 patients. Also, to clarify the data validation audit sample, if you're submitting data for 2025 and you have less than 10 of whatever submission type, whether that be individual clinicians, groups, APM entities, subgroups, or a combination of those, if you have less than 10, you must audit all of those submission types. For completion of our targeted audit, the QCDR or qualified registry must conduct targeted audits in accordance with the data validation audit. If a data validation audit identifies one or more deficiencies or data errors in the QCDR or qualified registry, the QCDR qualified registry must conduct a targeted audit into the impact and root cause of each deficiency or data error for the MIPS payment year. The QCDR or qualified registry must conduct any required targeted audits for the MIPS payment year and correct any deficiencies or data errors identified through such audits prior to the submission of data for the MIPS payment year. The QCDR or qualified registry must conduct a targeted audit using the sampling methodology that meets the requirements described in the data validation audit. The sample for the targeted audit must not include data from the sample used for the data validation audit in which the deficiency or data error was identified. In a form and manner and by a deadline specified by CMS, the QCDR or qualified registry must report the results of each targeted audit, including the overall deficiency or data error rate, the types of deficiencies or data errors discovered, the percentage of clinicians impacted by each deficiency or data error, and how and when each deficiency or data error type was corrected. Next slide. QCDRs and qualified registries must submit a 2025 data validation execution report with the results of their executed data validation strategy to CMS by June 1st, 2026. The DVR should include the overall data deficiencies or data error rate, the types of deficiencies or data errors discovered, the percentage of clinicians impacted by any deficiencies or error, and how and when each deficiency or data error was corrected. The DVR template will be posted on the QPP resource library. Also, to note, any late, incomplete, and or absent submission of your DVR or the results for a required targeted audit constitute non-compliance with program requirements and may result in remedial action or termination of the QCDR or qualified registry. This also includes sending an email to the PIMS team and CMS notifying us that you did not submit data for the given performance period. Next slide. QCDRs or qualified registries must attend and complete training and support sessions in the form and manner and at the time specified by CMS. CMS will host a series of trainings that consist of an annual kickoff, monthly support goals, virtual office hours, and public webinars and demonstrations. CMS will host monthly support goals for approved QCDRs and qualified registries. The monthly support goals will consist of program announcements, informational presentations, and demonstrations addressing reporting requirements and steps for successful data submission. This meeting series also provides an opportunity to ask CMS subject matter experts technical questions related to MIPS reporting and data submission. Questions and feedback concerning CMS policy and non-technical questions will be referred to the QPP Service Center. Participation in the monthly support calls is mandatory. CMS will also host monthly virtual office hours for approved QCDRs and qualified registries. The virtual office hours offer QCDRs and qualified registries an opportunity to ask CMS subject matter experts questions related to the assigned topics for those calls. Only topic-specific questions will be addressed during each call. All other questions will be referred to the QPP Service Center. Participation in the virtual office hours isn't required, but is strongly encouraged. CMS will host public webinars and demonstrations throughout the year to allow existing and prospective QCDRs and qualified registries the opportunity to attend the sessions. Registration is required to attend the public webinars and demonstrations. Participation to the public webinars and demonstrations may differ between calls and may be communicated as appropriate. Next slide. Beginning with the 2024 MIPS performance period, a QCDR or qualified registry that was approved but didn't submit any MIPS data for either of the 2 years preceding the applicable self-nomination period must complete a self-nomination participation plan for CMS's approval. This self-nomination participation plan must include the QCDRs and or qualified registries' detailed plans about how the QCDR or qualified registry intends to encourage clinicians to submit MIPS data to CMS through the QCDR or qualified registry. Next slide. CMS policy prohibits non-U.S. citizens from accessing CMS IT systems and requires all CMS program data to be retained in accordance with U.S. federal policy. Specifically, the NIST Special Publication 800-63, which outlines enrollment and identity-proven requirements for federal health IT system access. Access to QPP requires passing a remote or in-person federal identity proofing process that is Equifax or equivalent. A non-US based third-party intermediary's potential lack of a social security number, TIN, US-based address, and other elements required for identity proofing and identity verification would impact their ability to pass the background checks. An inability to pass the identity proofing may limit or fully deny access to QPP if the intent is to interact with the QPP outside of the US for reporting and storing data. The calendar year 2019 Medicare Physician Fee Schedule final rule for the QPP amended this requirement to indicate that a third-party intermediary's principal place of business and retention of associated CMS data must be within the US. Next slide. CMS has the authority to impose remedial action or termination based on its determination that a third-party intermediary is non-compliant with one or more applicable criteria for approval, has submitted a false certification, has submitted data that's inaccurate, unusable, or otherwise compromised, hasn't maintained current contact information for correspondence, or is on remedial action for 2 consecutive years. Next slide. QCDRs and qualified registries that have remedial action taken against them will be required to submit a corrective action plan to address any deficiency and detail any steps taken to prevent the deficiencies from recurring within a specified time period. The third-party intermediary is required to submit a CAP via email by a date specified by CMS. The CAP must address the following issues unless different or additional information is specified by CMS. The issues that contributed to the noncompliance, the impact to the individual clinicians, groups, virtual groups, or APM entities, including Shared Savings Program ACOs, regardless of whether they're participating in the program because they're MIPS eligible, voluntarily participating, or opting into participating in the MIPS program. The corrective actions implemented by the third-party intermediary to ensure that the non-compliance issues have been resolved and won't recur in the future. The detailed timeline for achieving compliance with the applicable requirements. Develop a communication plan for communicating the impact to the parties identified and finalized according to 414.1400E1IB. This would include individual clinicians, groups, roadshow groups, subgroups, or APM entities, including Shared Savings Program ACOs, regardless of whether they're participating in the program because they're MIPS eligible, voluntarily participating, opting in to participate, and or ever be participating in the MIPS program. And communicate the final resolution to CMS once the resolution is complete, and provide an update, if any, to the monitoring plans provided. Next slide. Failure to comply with the remedial action process may lead to termination of third-party intermediaries for the current and or subsequent performance year. If a third-party intermediary is terminated, a transition plan must be submitted by a date specified by CMS. The transition plan must address the following unless different or additional information is specified by CMS. State the issues that contributed to the withdrawal mid-performance period or discontinuation of services mid-performance period. State the number of clinicians, groups, roadshow groups, subgroups, or APM entities, including Shared Savings Program ACOs, inclusive of MIPS eligible, opt-in, and voluntary participants that would need to find another way to report and as applicable, identify any QCDRs that were granted licenses to QCDR measures, which would no longer be available for reporting due to this transition. State the steps the third-party intermediary will take to ensure that the clinician groups, virtual groups, subgroups, or APM entities, including share program ACOs, as identified in the rule, are notified of the transition in a timely manner and successfully transition to an alternate third-party intermediary. Submitter type, or for any measure or activity on which data has been collected, collection type as applicable. Required of the transition plan include a detailed timeline of when the third-party intermediary will take the steps identified as noted in the rule, including notification of affected clinicians, groups, virtual groups, subgroups, or APM entities, including shared savings program ACOs, the start of the transition and the completion of the transition. The third-party intermediary must communicate to CMS that the transition was completed by the date included in the detailed timeline. The 2025 QCDR and qualified posting and QCDR and qualified registry qualified posting will be updated to reflect when remedial action has been taken and or termination of a third-party intermediary participation as a qualified registry. I will now turn it over to Anastasia Robin for a demonstration of the system.
Thank you, Hector. We will go ahead and share an internet browser. So bear with me just one moment here. Okay, so in order to self-nominate, you will need to navigate to the QPP or the Quality Payment Program website. With that, this is just the landing page as you navigate to that website. Of course, up in the upper right-hand corner, there is a link to sign in. If you already have a QPP account, you would go ahead and enter your information and follow all of the prompts for any necessary two-factor authentication and things like that. If for some reason you do not have any QPP account at this point in time, you can of course also register for a QPP account here. So of course, if for some reason you need to obtain that account, please go ahead and click that register for QPP. There's additional information at that link, user guides, things like that, if you do need to access that information. So please access that to register for account, otherwise sign in. I have pre-signed in already, so I will note that we'll go right over here to the self-nomination system. Now, I am in a different environment than what you would see self-nominating on your site, so you may see a few differences here as this is a test site prepared to demonstrate this information to you. So again, there might be some minor changes or some things that look just slightly different from my site here to yours, so keep that in mind. As you can see, though, on this landing page, there is the timeline. So, of course, self-nomination opens on July 1st at 10 a.m. Eastern, and will close on September 3rd at 8 p.m. Eastern. Please make sure all updates to your self-nomination are done by that deadline, as, of course, the system will lock down and you won't be able to do any more updates to the fields or submit that self-nomination to us. So please pay note to that deadline. And then additionally, once we've processed all of these self-nominations, completed a few additional steps, we will publish the approved intermediary list on the QPP website by January 1st of 2025. So that is the timeline there. As you can see here, we have a few test self-nominations already out here just for the purpose of the demo, as well as some additional testing. So we'll go through some of these, but we'll go ahead and go through some of the functionality. If you are an existing intermediary from 2024, you will already have a self-nomination populated within this landing page for you. If you are an intermediary that is still in good standing, you'll actually have a simplified form that is mostly pre-populated for your review and resubmission. If you are an intermediary that has been placed on remedial action for one reason or another, you will still have a link here or an entry here. However, you will have to populate all of that information. So the one thing I will note is if you are an existing intermediary, please go ahead and either use your entry that is located here rather than adding a new one, or if for some reason your simplified form or your renewed form is not located in this section, please go ahead and click intermediary not listed and follow the directions that populate up on this. If for some reason you have any issues with finding your intermediary's self-nomination or simplified form, please reach out to the QPP Service Center and we'll assist that you do that, that you're able to find it. Your renewed form or your simplified form is tied to your unique vendor ID number that you have once you've been approved, and we like to carry that over year after year after year. So it is imperative that you use the existing self-nomination that's been created tied to your existing vendor ID. If you are, though, a new intermediary or perhaps a new partnership, or you have significant changes to your existing organization, you would go ahead and add a new intermediary. And in that sense, you would, of course, click the link, add your intermediary name, and then select whether you're a qualified registry or a QCDR or which you're planning to self-nominate for. Please note that if you do want to participate as both intermediary types, you do need to select two different self-nomination, or you do need to create two different self-nominations, one for qualified registry and one for QCDR. With that said, as I mentioned earlier, we have a few sample ones for the purpose of this demonstration. So we've got a QCDR self-nomination as well as a qualified registry self-nomination. There are a few functions on this screen, and then we'll jump into the actual self-nomination to just demonstrate the fields and the tabs within there. So to start, if you do need to change your intermediary name, there is a pencil icon that you can click and type the new intermediary name that you would like to be referred to as. The eye icon right here is managing your watchers. So this will identify who has the ability to identify or to locate and update your self-nomination. If you have multiple people within your organization that you would like to have access to your self-nomination, we would of course recommend that you would put all of their names in here. Having a backup is a great idea, as we do communicate a lot of information through the self-nomination. So having multiple folks be able to access self-nominations is beneficial when perhaps somebody is sick or people go on vacation. You always have somebody there to monitor those comments we may post or the requests that we need to be processed. So again, if you have multiple people in your organization, please make sure that they are listed as a watcher, and of course have the necessary QPP account to be able to access that self-nomination. And then of course there's the print function if you'd like to print your self-nomination. The next line here is just a few kind of informational items. This is a new self-nomination that I created for the purpose of the demo. If for some reason you have a simplified form or a blank one that's just renewed, you'd see other statuses here. In addition, we show the nomination status. As you can see, the QCDR self-nomination for this demo, I have approximately 87% complete, whereas the registry is only 4% complete. So you can certainly see where everything is at the process, how much more work you have to do in order to be able to submit that to CMS for processing. You, of course, then have the edit option, which we'll click here shortly, and the withdraw option. If for some reason you decide you do not want to self-nominate this year, you can just click that withdraw button and we'll take it out of consideration and not process that for the 2025 MIPS performance period. Additionally, we do have a comment section, which we'll go into more detail once we're in the self-nomination. You can access it here, the comment field, by clicking View Latest Comment, or you can access that information within the self-nomination as well. So this landing page provides all of that content, and now we'll navigate into our QCDR demonstration to actually demonstrate the field. I will note that we are going to demonstrate the QCDR self-nomination, as the QCDR self-nomination form looks very similar to the qualified registry self-nomination, with the exception that there are a few additional fields available within the QCDR version of the form. So that's why we're demonstrating this. If you are planning to self-nominate as a qualified registry, there are certain fields you will not see in the qualified registry self-nomination form. So with that, towards the top, as I mentioned previously, there is an area to view and add comments from inside the self-nomination. This is where we'll do a lot of communication with our entities to see, to ask questions, to see if there's additional information that needs to be updated or provided in order to process your self-nomination. So please pay note to these. When a comment is posted within your self-nomination, The individuals with access to the self-nomination should receive emails indicating that a comment has been posted. At sometimes, because they are system generated, we do have issues with it going to perhaps your spam folder or your junk folder. So please pay note to that, or make sure that those are sent right through to your inbox. As you can see though, I have a few sample ones populated here. So we do have comments that have already been here and categorized differently. So this top comment, we did just categorize that as self-nomination. And then the second one is QCDR measure. So as you can see, when I hit add comment, you can add your own subject. It can be self-nomination, qualified posting, QCDR measure specification posting, and then general. We would highly recommend that you use the appropriate category for whatever your comment is related to. That way we can use filtering to filter through the comments. As this process goes on for months, we tend to get lots and lots of comments out there. So if for some reason you would like to look for a specific comment that was posted, or we would like to do that, it's easy to filter and try and find those questions or comments that we have related to those specific topics. So you would, of course, select your comment subject area, and then you would go ahead and type your comment in. You can also attach files and then manage your watchers for who may need to see that. Once you hit send, you'll see it populates out here. And as I mentioned, there's a filter option. So you may filter to whatever question topic area you're looking for. If perhaps you have a question related to a comment that was posted on QCDR measure, you can then filter those comments and only see the ones specific to that area. With that, we'll go ahead and close out of the comment area. We also have a guides and help section. So you can certainly review this information. It will help you populate your self-nomination. Also, helpful resources that you can access. So the About and Instructions just provides detailed instructions, as well as Paperwork Reduction Act information, should you wish to review that information. And then additionally, we have the resources. So on both the QCR and the Qualified Registry self-nomination, you'll see the resources available to help you with the self-nomination. So there is a lengthy 2025 self-nomination user guide, which includes detailed step-by-step information on how to populate the self-nomination form, including screenshots and helpful information. We have a 2025 QCDR fact sheet, which would, of course, provide information related to the self-nomination process, as well as requirements and such for QCDR measure self-nomination and the QCDR measure submission process and requirements associated to that. We also include a 2025 QCDR measure development handbook that will be very helpful if you are planning to submit any type of QCDR measures for consideration this year. So please familiarize yourself with that. Of course, on the Qualified Registry side, you will only see the you will only see the Qualified Registry fact sheet and the self-nomination user guide. Outside of self-nomination tool, if you want to access those, they are available in the self-nomination toolkit on the QPP resource library. So you don't have to log into the tool just to access those links. They are available on the resource library. With that, all the way over to the right then, I will just note that you can see here all changes have been saved, and then there's a save and close option. The changes as you make them do save automatically, but if for some reason you want to close out and come back to it at a later time, you are welcome to use that save and close option and return to update further and submit as needed. Again, just make sure you're paying note to that September 3rd deadline. Then we have this pane that's over towards the left. It's our left navigation pane, and kind of lists out all of the different tabs that we have to have populated for the self-nomination form. As you can see, there's various icons. The green check mark means that that particular tab has been fully populated. The yellow circle that's half filled means that that tab is halfway populated, or at least partially in some sort. The icons then that are just a blank circle are ones that have not even been started yet. So I sampled a few of them and made sure that you had a good idea of kind of what those look like. Now, in order for you to be able to submit your self-nomination for review, a complete form is required. So all of those circles will need to be the green check mark before you are able to submit for review. So once we populate all of these and have all of these as a green check mark, we will be able to submit for review, which of course then the PIMS team will take a look and review and start that communication process with you. If for some reason you would like to withdraw, again, you will have the option to withdraw. So if for some reason, again, you change your mind, don't want to self-nominate for 2025 anymore, you can certainly click the withdraw button on this screen or the previous one that I discussed earlier. With that, we'll go through some of these tabs. So the first tab here is the intermediary contact information. This just contains a lot of organization information. So your organization name, if for some reason it is the same as your intermediary name, you can just click the button, same as intermediary name, or you can type that in. If you have any partnerships or collaborations, could perhaps be an organization that you're partnering with for a clinical perspective or a technical perspective, all of those partnerships should be listed here within the partnerships and collaboration field. Your tax ID number would also be required. And then we do like to know if you are planning to self-nominate as both a QCDR and a qualified registry, so we can track that accordingly. Again, intermediary staff access, that's similar to what we were discussing earlier on your manage access, manage watchers field that we discussed, the eye icon that we've already referenced earlier. That would be the same field. So that would just give folks an additional access to your self-nomination. Then we collect the address information, phone number information, and your website information for your intermediary. Then we collect program contact information for your main program contact, as well as your clinical contact and your technical contact. We collect their names, their phone numbers, and their email addresses. I will note that we do request that you do provide us the direct email address as well as the direct phone numbers for these individuals. The contact information within these program, clinical, and technical contacts will not be published anywhere, but we use it for the purpose of reaching out to you. If there's some type of a concern with your intermediary, a question, anything to that effect, we'll reach out directly through those numbers. So we understand that publicly you might want to use like a help desk or something to that effect. These particular fields will just be used by CMS and the PIMS team internally. So please make sure to include that information. I will also note that the system, does require that you provide unique email addresses. So you will have to provide at least 3 unique email addresses, one for the program, one for the contact, one for the clinical, and one for the technical. Otherwise, the system will not allow that page can be completed. The remaining field here is just additional contact information. So we understand that you do have to have the main program, clinical, and technical contact above, but this field right here would be any additional emails you would like included on the distribution list. Please note that we do create a new distribution list with the self-nominations every year. So if for some reason, you have folks added to the 2024 list, please still make sure that you add them here to the 2025, as we will just export these contacts, and anybody within these self-nominations will be the ones to start receiving our communications. As you can see, this tab has already been completed, so we are just going to move on to the next tab. You can certainly do that by either clicking the appropriate tab on the left navigation pane, or the bottom right corner also has an intermediary details link as well. Either one works. Now, for this next tab here, it's just information specific to your actual QCDR qualified registry. First field, we're just asking for information related to what type of an intermediary you are. Are you a health IT vendor, a specialty society, or whatnot? There are certain elements within here that will require an additional response. So if you do select other, you will need to type some type of a response in the fields. So please make sure that if an intermediary description related to your intermediary type is required, that you do populate that information. And then the next field is related to your prior MIPS and PCRAS participation. If you are a new entity, you will just particularly click that and you won't see a lot of extra fields. If you are existing, you will see the additional fields that do require that you populate what years of PCRAS and or MIPS you have participated in. And that correlates to the next field, which is, has your intermediary participated as a QCDR or qualified registry during the past 2 years? If you have, you would click yes. If no, then you click no. Of course, if you click no, there's nothing additional needed. However, if you have participated in the last 2 years, you are required to answer a couple of additional questions. So the next question is, did your intermediary submit any data within the last 2 years? If the answer is yes, nothing additional. I'm sorry, if you click no, nothing additional will be needed. If yes, you will have to submit a self-nomination participation plan, which Hector detailed a little bit earlier, and additional information is accessible in the QCDR and qualified registry fact sheet if you need additional information to there. So a few additional fields will populate there if for some reason you do need to submit a participation plan. The next couple of fields are just related to any alternative names that you may use. If for some reason you have some type of an acronym or maybe a historical name, something to that effect that you may refer to yourself as, we would recommend that you put it in this field for purposes of like support call attendance, things like that, emails that may come into us. If anybody would generically refer to your organization or your intermediary by some acronym or maybe some other name outside of what your intermediary name is listed as in your self-nomination, we would just want to include that here. That way we can certainly make sure that we attribute that content back to you. Then we collect your specialty, could be all sorts of them, could be a specific one like just cardiology, just primary care, or you can certainly put all specialties if you support all specialties. The next field then is, do you plan to submit QCR measures? For the purpose of this demo right now, I just have that as a no, as the QCR measure submission demonstration will occur later. But if you do flip that to a yes, you will see that a QCR measure tab does appear to the left. So that again will be demoed later, but on this intermediary details tab, this particular field will indicate whether or not that QCR measure tab will show. I'm going to flip it back to no, as again, that'll be demonstrated later, and you'll see that the QCR measure tab has disappeared. The next section is ensuring that you meet the definition of a QCDR. Acting as a QCDR does take a few more expertise and experience than a qualified registry does. So we want to make sure we collect that information. Simply stating that you have clinical expertise like this first field here is not sufficient. We really need detailed information on what kind of clinical expertise, measure development experience is within your QCDR. That way we can ensure that you do meet the definition of a QCDR per CMS requirements. We'll also collect the QCDR partnership and collaboration information here. Please detail out the information of those collaborations, so don't just list them. If for some reason you're collaborating with an organization as a clinical platform or a technical platform, we really want to know the details there. And then of course, we'll collect the information on how you do patient and disease tracking and how you're fostering quality improvement. That is the end of that tab. We'll move over to the qualified posting details tab. This tab specifically will collect information that will be posted on the public qualified posting that will be on the QPP resource library once we have completed the self-nomination process. So we do want to make sure that when you're populating this information, you make sure that number one, it's 100% accurate, but we would also ask that you make sure that your spelling and your grammar, things like that, are up to date as well. Spelling out acronyms, things like that, because we do want to make sure that the audience that'll be navigating to the QPP resource library to use the qualified posting is also able to understand exactly what's being said there. So all of this information will eventually be published. You will have to provide cost information. We do ask that you indicate, is that cost per group, per clinician, per APP, APM, what is it for, as well as the frequency of it. Is it per year? Is it per month? Is it per occurrence? We have all sorts of different costs that our intermediaries charge. Then the next field, you can detail the services that are included in those costs so that clinicians know what the services are they will be getting for paying those amounts. The next is last day to accept new clients. Of course, for self-nomination period of 2025, submission will actually not occur until January 1st, January 2nd through March 31st of 2026. So you want to pay note to the day here, the performance period you're self-nominating for, as well as the submission period. With that, I have right now 12/31 of 2024. Obviously, that's pretty early for a 2025 performance period last date. So feel free to select whatever you'd like to have there for that last day of when you'd like to select to accept new clients. Please note that you may want to, review the requirements, especially data validation, to make sure that whatever date you're setting here, you do have enough time to perform all validations, feedback report requirements, things like that for your clients. So again, just pay note to those. Then we just collect some generalized information. Data collection method is what type of processes or systems you use to collect your data from your clients. You can select all of these or other if it's a different option. Of course, if it is other, you will be required to type in a description for that other method. Performance categories reported is improvement activities, promoting interoperability, or quality. Now, quality and improvement activities are required. So those are, you can see, you cannot unselect those. Promoting interoperability, on the other hand, is required. However, there is an exception. So if you do meet the exception, which of course information detailed to that exception can be found within the fact sheets or within the user guide and things like that. But if you do uncheck the promoting interoperability option, then you will have to indicate if you meet that exception and then provide details on how you meet the exception if necessary. I will note that when we look at this particular field, we will also make sure that the quality measures, improvement activities, and promoting interoperability tabs on the left navigation pane here match. So for some reason you unselect promoting interoperability, we would note that your promoting interoperability tab would not have anything there. Then we collect the reporting options supported. Traditional MIPS, APM Performance Pathways or APP, or the new MVP MIPS Value Pathways. That's just recently been a new option as of 2023. So with that, if you're planning to support those, you would check those options. MVP is a required thing for our intermediaries, but again, there is an exception available. If for some reason you're not reporting MVPs, we would ask for you to indicate that you do meet that exception and provide the reasoning as to how or why you meet that exception. Again, you may select all of these. And then the last one here is participation options supported. We ask that you would select any of the different participation options supported, whether it's group, virtual group, APM entities, MIPS individual clinicians, and subgroups. Please note that if you are supporting MVPs, you are required to support subgroups as well. So I will note, as of right now, you can tell I'm only in progress in populating this tab. I'm going to just go ahead and select a couple here, and then we'll be able to see that this will populate as soon as I enter in virtual group specialty parameters. So if for some reason you are doing specialties, virtual groups, you do have to say exactly what specialties groups you're planning to support. And with that, every field on this tab has been populated in some form or another. So you can see that it has now been marked as completed. The next tab is attestations. I'm going to go very briefly through this because Hector did just discuss all of these requirements in the presentation. However, when you are self-nominating, I would highly recommend that you review all of these attestations, as these are requirements that you are required to comply with and meet throughout the 2025 MIPS performance period in order to be able to be accepted. If for some reason you cannot attest yes to one of these, you'll not be approved as a QCDR or qualified registry. Also with that, if for some reason you do attest to meeting these requirements and for some reason or another aren't able to do so during the year, there would likely be additional discussions about remedial action or termination. So please make sure that you do meet all of these requirements. I've already pre-selected yes on all of these, but then we do ask for somebody to kind of give the attestation of who went through and checked those boxes at the end. As you can see, we now have a completed field, and we'll move on to the next tab. Now, the improvement activities promoting interoperability, MIPS clinical quality measures or CQMs, as well as MIPS electronic clinical quality measure ECQMs, Tabs are very similar, so I'll go into detail on a couple of them and then just notate the differences on the additional ones. So the first tab here is improvement activities. This is where you will select the improvement activities you plan to support for the MIPS performance period. You'll see the options are all or some. So you can just go ahead and select all if you're planning to support all improvement activities, or some if you plan to just support some of the improvement activities. And then you would have a drop down where you would select the exact improvement activities you're planning to report. I do want to know, as you see here, and as you're probably well aware, the next proposed rule has not been released yet and will likely not be released until July timeframe. So with that, this particular dropdown, as well as those other tabs that I referenced, is populated based on the 2024 Physician Fee Schedule Final Rule. We understand that there may be updates to this list, as well as those other lists, published with the 2025 proposed rule, as well as the final rule, which will be available sometime in November usually. So what we'll do is we'll accept information based on the 2024 rule, and so you would populate that information. If for some reason you need additional information related to the improvement activities available, there's of course an option for you to navigate to that particular field. To that section of the QPP resource library and locate those improvement activities. You will note there is no none option on this particular screen because you are required to support improvement activities. Moving on to promoting interoperability. It is the same. The information's based on the 2024 rule will be updated when the 2025 information is released. There is measure description information if you'd like to click the link here and navigate to the actual promoting interoperability measures. And then of course, we have all, some, or this one does give none. If you did meet that promoting interoperability exception that I discussed earlier, you could select none. Otherwise, you will be required to select all or some. Again, with some, you would select the necessary measures that you're planning to support for the performance period. Moving on to the CQMs. Now, we do want to note that QCDRs and qualified registries are required to support at least a minimum of 6 quality measures, including 1 outcome or high priority measure. Additional information related to that can also be found in the fact sheets. But with this, we do want to note that there is the all, the some, and the none option again. You can certainly select some CQMs, some ECQMs, but one measure and you're reporting it as both the CQM and the ECQM collection type would only be considered one measure. So we do want to make sure you're selecting 6 unique measures for registries, qualified registries that would be across the CQMs and the ECQMs. For QCDRs, that could be across QCDR measures that are accepted, as well as the CQMs and ECQMs. But again, they must be unique measures. Additionally, you'll find that there is information here related to the Medicare CQM for accountable care organizations. So you will see that if you'd like to report measure 1, 134, and 236, there is that option for the Medicare CQMs. So please, if you are planning to support those, make sure that you do select those particular measures. And then of course, just like the last 2 tabs, we do have the links available for the measure descriptions, and you can select all, some, or none. We'll go ahead and just select some and just demonstrate again a couple here. So we've selected a couple of measures. Moving on to the ECQM. Same as the last few tabs, populated based on the 2024 rule. There could be updates. We do have the link to the measure description information. And then again, you can select all, some, or none. But just again, please make sure that you have at least 6 quality measures. So I've got 3 CQMs and 3 ECQMs that I've populated here. The MVP tab then is similar, but also different. So we'll notate that real fast. As the most recent rule gave intermediaries a little bit more flexibility on being able to support certain measures within an MVP, we are collecting more detailed information related to the MVPs. So what you'll do in this first field, well, first of all, I should say you can select all like you're supporting all MVPs. If that is the case, then you would just select the all. If you're supporting none of the MVPs, of course, you would select none. Or if you do some, you would then select which ones are available. So I'm just going to select 2 here and pretend I'm supporting these 2 MVPs. With that, we want to track which measures available in each of them are available from your intermediary for your clinicians. So you will be able to select any of these measures that are within that particular MVP for reporting. Please make sure that you select the appropriate collection type, whether you're supporting it as a CQM, an ECQM, or a QCDR measure. Some QCDR or some MVPs will not have any QCDR measures, so you'll have the none option for those. On the other hand, if you are a qualified registry, you will not have the ability to support QCDR measures. I'm just going to select a couple here just so that we can turn our screen. There we go. And we'll go ahead and move. Oh, let's actually. There we go. Sorry, just for the purpose of the day's demo, I just want to make sure we get the completed icon there, but you will, of course, select all MVPs and then all of the measures within the MVP for reporting. Data validation is the next tab, and you will just detail all of this information. Now, Hector detailed a lot of this content within the presentation. So what we would just ask is that you do provide detailed information on how you verify MIPS eligibility, the accuracy of TIN and NPIs, how you're verifying that you're calculating reporting rates and performance rates accurately, ensuring that you're using the 2025 versions of the measures and activities to ensure that the specification is being followed exactly as specified for that particular performance period. And then you'll also detail the process for your data validation audit and your targeted audit. The last field here then is the benchmarking capability. So with that, I will just note you can either browse or you can drag and drop, but benchmarking capability is required. So you will need to put that you are able to benchmark your data, and then you'll need to provide your benchmarking methodology attachment. Once you've done both of those, you will see the green check mark as well. So with that, we have completed all of our green check marks, and our self-nomination is available to submit for review. Our status has changed from a work in progress to also a draft complete, and then we'll submit it for review. You'll of course get a little confirmation, just making sure you do want to submit it for review. But once you do, you will see it's successfully submitted for in self-nomination review, and CMS and the contracting team will take a look at that and start communicating again through that comment process. So please keep an eye out for emails from the tool. With that, since I did not have any QCDR measures here, I'm just going to go ahead and save and close and turn the call over to our next portion of the presentation, which will detail more of the information for the QCDR measure requirements and self-nomination submission process.
Thank you, Anastasia. This is Stacy Sams with the PIMS team. Over the next several slides, we're just going to do a quick overview of information to help those of you who will be submitting QCDR measures within your self-nomination. And this will be followed by a demonstration on how to populate the QCDR measures tab. Next slide, please. To submit QCDR measures for CMS consideration for the 2025 MIPS performance period, you'll need to navigate to the 2025 self-nomination QCDR measures tab. After the self-nomination period closes, CMS will review every QCDR measure that was submitted and bases approval upon different criteria. And on this slide, we have a few of them included. First, QCDR measures should be developed and implementable and be on the measure concept phase. And CMS also prefers measures that address a variance in performance, and measures that are outcome related are preferred over process-based measures. Beginning with the 2024 MIPS performance period, QCDR measures must also be tested prior to being self-nominated. A new measure in its first year being submitted requires face validity at a minimum, and existing measures previously approved and being submitted for a subsequent year must be fully developed and tested. QCDRs are also required to collect data on their QCDR measure appropriate to the measure type prior to submitting it with your self-nomination. And last, try to avoid submitting measure concepts that are already implemented in MIPS, either as a QCDR measure or MIPS quality measure. Next slide, please. QCDRs are allowed to submit up to 30 QCDR measures per self-nomination period. Each measure will have various fields that are required to be filled out, and the required fields will be marked with an asterisk within the self-nomination. Required fields will vary depending on the measure owner status, if the measure is owned or borrowed, and also whether the measure is a new measure or an existing measure. Please utilize the help text that accompanies each field, and also there's helpful information in the self-nomination user guide that can further guide you when you're populating this measure information. And you can also submit a comment directly in your self-nomination if you need additional help, as we do monitor those daily. If measure is being borrowed from another QCDR, written permission must be obtained prior to submitting the measure. And Marlo will be showing you where this is located, but there is a box within the self-nomination where you can upload that documentation that shows the agreement between you and the QCDR who owns the measure. Excuse me. When submitting a borrowed QCDR measure, there's just limited information that's required to be filled out by the QCDR who is borrowing the measure, and the PIMS team will take final measure specifications from the measure owner and populate that later on in the process. And if there are any measures from the previous self-nomination period in your QCDR measures tab that you do not wish to self-nominate for this self-nomination period, then we ask that you place those in the withdrawn status. And last, QCDRs who are in good standing, as Anastasia noted, will have pre-populated QCDR measures in their self-nomination, and these will only include those measures that were approved for 2024, for the 2024 performance period. You'll still need to review each of those, as there may be new required fields for the 2025 self-nomination that may be empty and need to be populated. Next slide, please. We do encourage you to complete spelling and grammar checks and internal quality assurance to identify and correct any errors prior to submitting your measures, ensuring all drop-downs were selected properly, and any and all changes that you made to a measure from the year prior are captured, and even if the change does not impact the measure's intent, please submit those. And finally, there is a QCDR notes field at the end that you can utilize to submit any additional pertinent information for each measure that you would like to communicate. Next slide, please. So now we'll just do a quick review of the QCDR measure testing requirements. Measures being submitted for its first time are considered new measures, and at a minimum, new measures require face validity for their first self-nomination. For subsequent self-nominations and after being approved, the measure is considered an existing measure, which are required to be fully tested and developed. And this consists of empirical validity, feasibility, measure score reliability, and to be fully developed includes patient encounter level data element testing, and this can be completed either validity or reliability. Next slide, please. For the 2025 self-nomination, we did make several updates to the measure testing fields. The data that we need for each testing component, face validity, empirical validity, measure score reliability, and data element testing have each been broken down into these 5 different fields. So you'll have an area to submit the type of analysis or statistic name used, the level of analysis, the sample size used for testing, and the statistical results of the testing, and finally a testing interpretation. We did update the help text that should help give examples and further guidance if needed. And also measures to be included in an MVP must be fully developed and tested. Next slide, please. These last 2 slides just show some examples of testing and suggestions for completing the testing fields. Some examples for empirical validity are construct, convergent, discriminant, and predictive. For feasibility, there will be 3 choices to choose from for the extent that the measure's specified data elements are available in electronically defined fields. There will also be an additional free text field where you can provide any additional information for confirming feasibility for that measure. Next slide, please. Finally, a couple examples of measure score reliability are signal to noise using beta binomial model and temporal correlation or random split half correlation using interclass correlation coefficient, among others that are listed and provided also within the self-nomination tool. And last, to be considered fully developed, a measure must have patient encounter level data element testing. Again, this can be their validity or reliability, and data elements that are already established as reliable, such as age, do not have to be retested. Some examples are criterion validity, test retest, and intra or inter-rater reliability. Next slide, please. And I will now turn it over to Marla Throckmorton, who's going to do a demonstration for how to submit QCDR measures in your self-nomination. Marla?
Thanks, Stacy. I just want to verify that you can see my screen with the self-nomination form up.
Yes, we can.
All right, thank you. All right, we're going to go through the process of how to self-nominate a QCDR measure for the 2025 MIPS performance period. As noted by, I just want to make a disclaimer that there are times that I might say QCDR measure, or I might just say measure. In this instance, we are in, for the purposes of this talk, anytime I say measure, I am strictly referring to a QCDR measure. I also want to point out this left pane as shown by Anastasia. Down at the bottom, there's the submit for review, the withdraw, the reject. These items are strictly for the QCDR itself. These are not for each individual measure. I will show you later how to actually withdraw a single measure. But please remember, these are strictly for the QCDR. All right, so the first tab that will then determine whether or not you have the opportunity to enter your QCDR measures is on this intermediary details tab. And there is a question that states, do you plan to submit QCDR measures? If you say no, then you do not have a QCDR measure tab over here in the left pane. But once I say yes, you'll see here that this QCDR measure tab becomes available. Once I click on that, you are brought to your QCDR measure landing page. This is where you will see which measures have been submitted to CMS, which ones are in draft status, and which ones are in non-active status. For those of you that do have the simplified self-nomination form, where your 2024 QCDR measures are pre-populated as drafts, you'll see all of those here in this location. These are only all the approved measures that occurred during the 2024 measurement period. I will probably say this a number of times during the demonstration today, but for CMS to review your measure and consider them for the program for 2025, by the close of self-nomination, they have to be in this submitted queue or tab or this submitted status. Any measures that remain in this draft or non-active status at the close of self-nomination will not be put forward for CMS to review. You have a maximum of 30 QCDR measures per QCDR for CMS consideration. The QCDR measure tab is what is used for self-nomination. And once self-nomination again closes, then on that, I believe this year will be September 3rd at 8:00 p.m. Once you get to that point, then this tab then becomes static. The measures stay in the format that they were submitted in. Further in the process to finalize the measure specifications after self-nomination closes and we get to that point, then there will become available a QCDR measure specifications tab. And that is where we notify the QCDRs of the measure decisions, have communication about things that might need to be changed, etc. So that will be later in the process. For the purposes of this demonstration, we're just going to talk about how to submit the QCDR measure. So let's look at one of these drafts that were populated in here. So you would have a measure that's entered and you would go to the edit details. Across the top, you can see here that there are 4 sections that have to be completed for each measure. Once all required fields are entered, then you'll see here how there becomes a green check mark. I completed this form earlier just for demonstration. So usually these will be like the half circles with yellow. They'll show that it's not complete. We have the measure info is our first section that we'll talk about. You'll see here is the question, basically what you need to fill in. The asterisk does indicate that this is a required field. If it's an optional field, you'll actually have text in parentheses that say optional. You can hover over the question mark for the help text that says, in this case, provide the title of the QCDR measure. There are different types of fields in this form. There are the text fields, such as this one. There are drop-down boxes. There are radio buttons. So as you go through, you'll see the different types of ways to fill out each field. So this first part, measure title, you would enter free text to indicate the measure title. Same for measure description, denominator, numerator, denominator exclusions. For example, for denominator exclusions, since not all measures include those, you'll notice it is a required field. So in order to make this field where it has to have characters present in order to be considered a completed field. So if you do not have a denominator exclusion, for example, you would have to enter in a not applicable, etc. for this required field to then be considered completed. Same for denominator exceptions and then numerator exclusions. This is one of our first fields that is a opportunity for a drop-down box. You'll see here that it does say select all that apply. As you can see here, there's an X next to each of these. If you can either get rid of one at a time. If you, for example, you thought, oh no, I entered the wrong ones, you can actually clear them all and start over. So when you use the drop down, you will see all the different ways that you can abstract your data. Administrative claims data, for example, and then claims, let's say. So you have these 2 entered. If you chose something such as, and you'll notice, I just noticed this earlier when I was working in this field. Once you have something entered into this field, you can't use the drop down anymore. You actually have to click underneath to get the drop down to then show up. So for example, if I chose other, you'll see here that an additional box popped up that said, enter additional information regarding the data source used. You'll see now that this measure info is no longer a green check because now I have a required field that is not filled out. If I get rid of other, it gets rid of that question, and we can move on to the next question. CBE ID, so if your measure, QCDR measure is endorsed, you would enter that endorsement ID here. Since this is an optional field, you could leave it blank or you could enter NA. Next question is high priority measure. Again, it's that same idea. If I enter no, it gets rid of the next question. But if I do enter yes, it wants me, it didn't do that, but it allows me to select my high priority type since it is a high priority measure. This is only you can select one as opposed to select all. These are all of the CMS approved options for high priority type. So we can select appropriate use, for example. Then we go to measure type. Again, with the drop-down box, you select one and you select one of the CMS approved measure types. Care settings. If you believe that your measure impacts all settings or can be measured in all settings, you would select that. You could select other ones as well. If you didn't select all settings, then you can select, urgent care and clinicians, for example. And then final question in this section is, does this measure include telehealth options? Yes or no? We're now entering the analytics section. You enter the measure calculation type. You have your options. You can have an inverse and a proportional measure, for example, so you can select multiple. Number of performance rates to be calculated and submitted. We did provide the options of 1 through 10, which would be a very large measure. We've never seen a measure larger than 10. If you did have more than 10, then you would select 10, and then in this performance rate description, you could include all of your rates, and we would then work with that. If you only have one measure performance rate in your measure, you're not really required to write in a performance rate description. And that's why this performance rate description does state as an optional field. But if you have 2 or more performance rates, we ask that you enter those descriptions here and use a format of rate 1, the description, rate 2 in the description, and then rate 3, for example. In this example, we wrote overall rate. Of course, that could be any of those descriptions. Then lastly, we request indicate an overall performance rate. This is a drop-down box where you have that 1 through 10th performance rate that you could select as the overall rate. Or if it's an average, weighted average or a simple average measure, you would then have the opportunity to select one of those options as your overall performance rate. Do you plan to risk adjust? Yes or no? No, you go to the next question. Yes, you do have additional answers that you have to answer. Enter a detailed description of your risk adjusted status. And then you also need to upload a risk adjustment file, either through browse or drag and drop. Is the measure able to be abstracted? In this instance, you are attesting that yes, you are able to collect the data on this measure to report for your clinicians or groups or all the other entities that are eligible. And then finally, there is a disclosure. Does this measure require the use of proprietary software, devices, etc.? Yes or no? This is the intent of this is so that a clinician would know if they needed to have special software, a certain device, or something like that in order to be able to report this measure. And next we come to our testing section. This year, this testing section, as Stacy mentioned, has gone through a major overhaul. We tried to break out the different components to better drive the way that you provide the testing answers that we need to determine whether or not appropriate testing was completed. Because each measure is in a different status. So you have a new measure, for example, that requires face validity, and it doesn't require all of the other types of testing. Or let's say you have an existing measure that may not necessarily require face validity, but then requires all the other types of testing. So all of the testing fields are, for the purposes of the form, say optional. But please remember that for the first year that the measure is being self-nominated for the program or would be in the program, we require face validity. For all the other types of testing, if it's an existing measure, meaning it has been in the program for at least 1 year prior, then you would be required to fill out all the other testing fields. So let's look at these. Face validity, type of analysis or statistic name. We did try to give those examples here in your help text. For example, modified Delphi using Spearman's correlation. You would enter that free text. Testing level of analysis. For example, you did subject matter experts to do the face validity. Sample size, you would, how many respondents did you have for face validity? Results, you would then provide the percentage that voted in favor of the measure's face validity. And then interpretation, you would then indicate whether or not you believed that this result did substantiate face validity. If you have a self-nomination form that was pre-populated for you with the measure, at this point, we have not fully seen whether or not how that's going to be populated here, but I am thinking that what you entered in 2024, which was just a simple text box for validity, will be placed into one of these boxes. And then you will probably have to cut and paste the different pieces and parts that you had entered to put them into the appropriate boxes. But I do think there will be a data dump into a single text box, and then you will have the opportunity then to edit that and then place them in the appropriate boxes. Next section, again, this is starting with our existing measures or a measure that has been in the program for at least 1 year. You have to have empirical validity. Type of analysis, again, the same type of boxes. So for example, empirical validity could be the construct, convergent, etc. validity. Testing level of analysis, sample size, results, and interpretation. We move on to reliability. This is measure score reliability. So type of analysis, testing level of analysis, sample size, results, and interpretation. The reason that we did say measure score here, reliability, because then when you get down to the patient encounter level data element testing, this patient encounter level can be done either as validity testing or reliability testing. So we need at least one form of the reliability testing to be measure score. You can then have patient encounter level data element testing then to work on for this section. And again, it has the same 5 text fields: results, interpretation, etc. Once we get down to feasibility, you do have this first drop-down box where you select about data elements in defined EHR fields. If for some reason you strictly have a true paper-based chart abstracted measure and don't have any data elements defined in EHR fields, you can leave that as the select feasibility. If you do know about the data elements, etc., and you want to enter or answer this question, then that is encouraged. And then finally, you have feasibility details. You would enter here any additional feasibility, the way methods that you used, anything else that you think is important for us to know as we review this measures testing. Supporting documentation is our final section. First question is describe link to cost, measure improvement activity. Since it is required and you don't, the goal is that you would have a link to either the cost measure or the improvement activity. But if there isn't one for your specific measure, you can then enter, because you do have to have text or characters in this field in order to fulfill the required requirements, then you would need to enter no link identified. At this time, all measures can be reported through traditional MIPS. So that is checked for all measures and it's grayed out, so you can't change that. But if you do have a measure that you have clinicians that want to report through a MIPS value pathway, it applies to the clinicians that report through your QCDR, then you would also select the MIPS value pathway. We have some additional text boxes. This is where you would write in your clinical recommendation statement for the measure, the rationale for the QCDR measure. And here you would write in your measure's performance data. This is required. And the format that we would like for you to use to report your data would be the number of months the data was collected, the average performance rate, the performance range, as well as the number of clinicians or groups that you collected that data for. This can be the data that your QCDR reported to MIPS in the prior year. This could be, while you were doing testing on the measure. It could be if it's, for example, if it's a new measure and you don't have data that's been reported to MIPS, you would still want to enter the data that you have collected as you were working through the testing of this measure. This helps support the claim that this is a measure that has a performance gap and could be meaningful in the MIPS program framework. If you have an existing measure, meaning again, the measure has been in the program for 1 or more years, and that measure has changes, we would like for you to indicate what has changed to the existing measure. This really helps the PIMS team and then CMS as we do your measure review to be able to focus on the changes that occurred to the existing measure. This will help us determine, for example, as we do our analysis, it'll help us look for things like, is this a substantial enough change that maybe a new measure ID is going to be required, which means a whole new benchmarking that is set up? Is it just a small text clarification that didn't really impact the intent of the measure, etc.? So this just helps us give a place to focus on the change and the intent of the change. This kind of goes back to that idea of if there was changes, we're asking, can the measure be benchmarked against the previous performance period data? If it's a new measure, then of course that answer is going to be no, because there hasn't been data reported to MIPS yet. But if it is an existing measure, if the measure hasn't changed, it should have the same benchmark, then you would answer yes here. If you did answer no for an existing measure, then we'd want you to explain here why the previous benchmark cannot be used, which kind of goes back again to this existing measure with changes idea. If applicable, provide the study citation to support performance gap for the measure. This is a good place for you to be able to enter citations that are current or within the last 5 years to help justify why the measure does have a performance gap in conjunction with the performance data that you have submitted. For measures that have been in the program for 2 or more years and have not achieved a benchmark, then you do have an opportunity to provide a participation plan for the measure. The participation plan is basically your plan of how you're going to get your clinicians or groups to increase the adoption of this measure. You can, there's lots of examples in a lot of our like our fact sheets, our user guide, for example. For example, you could say that you're going to require mandatory reporting of this measure by all your clinicians in your QCDR, and that's how you're going to drive up adoption of the measure. And then finally, we have these, or not finally, but we do have these 2 next questions about indicating specialties and published clinical categories. The purpose of these is, for example, once our QCDR measure specifications are published for that performance period, these on the QPP library or resource center, then that makes it available for clinicians who are looking for measures. They would be able to go to this spreadsheet and be able to say, okay, I'm an anesthesiologist, for example. I want to look for all measures that have a clinical category of anesthesia. I want to look for any of them that cover my specialty, for example. So this is important for ability to filter that spreadsheet to be able to, for people to focus in on the measures that apply to them. This also would then maybe lead them to your QCDR because they see that you're the QCDR that is reporting all of those measures. We do have just a free text field here called QCDR notes. This is basically where you can enter any information that you thought that you'd really like to communicate to CMS about this measure. You didn't see another good place to input that information. This might be if you were, working to resolve areas of duplication, for example. You could enter that information here. And then finally, if you did need a place to put some additional supporting documentation, you can drag and drop a file here for us to review. If you see here, now that we have all of the green checks, this Submit to CMS button has become activated or available. If, for example, I took away one of my required fields, you'll see here that Submit to CMS is grayed out. My only option then is to save and close this measure so then I can come back to it later. But if I go ahead and re-enter that, now all my required fields are entered. I do have this button again. So I've done my quality assurance. I've looked at spelling. I looked at grammar. I made sure I entered everything correctly in all the fields. And I've decided I'm ready to submit this measure to CMS. It brings up a form that you can do a quick read through of all of the measure information that you've entered. If you notice you made an error, you can cancel and go back and edit that measure. Or you've gone through and you've determined it's all correct and you want to certify and submit. And you'll see here, now this measure has been moved to this submitted status, which is where all QCDR measures have to live in order for them to be reviewed by CMS. The good news is, though, if you enter these in early July and later on you decide, oh, I need to change something about that measure. Until self-nomination closes, you do have the option of editing the details for that measure. So it's not finalized at that point. You are able to edit the details. I quickly want to show you how you can. So this is a borrowed measure. Required fields aren't filled out. I can't submit to CMS. I can only save and close. But then I do have this red withdraw. This red withdraw available to me. So I've decided, you know what, I don't want to enter this measure. I don't want to submit this measure. So I'm going to withdraw it. It's going to ask you, are you sure you want to withdraw? Yes, withdraw. Excuse me. And you'll see now it has become a non-active measure. Again, we want them all to be in submitted status for review or in this non-active status. Good news is you withdrew the measure and then you decide, you know what, with a few changes, I do want to submit this measure. Oops, sorry. You can go to view details. And you can actually return this measure to draft. So it has left this non-active. Now you have the opportunity to go in and edit the measure again. So please know, until self-nomination closes, you do have opportunity to work on all these measures. For new QCDRs that have never supported a measure, for existing QCDRs that did have their QCDR measures from the prior year populated for you, you went through and you had to go through every piece and part of that measure because, again, Remember, there are all those new fields for the testing. You have to go through each measure and complete them. Or, for example, you're an existing QCDR and you want to add a brand new measure that you've never self-nominated before. You're going to use this blue Add QCDR measure. The first question that's asked, and this determines the type of form that you have to fill out and the number of fields. You would have to decide, are you owning this measure? Yes. Are you co-owning this measure with another QCDR or more than one other QCDR? You would have to answer yes to these, but I'm going to show you how to do a borrowed measure. So in this instance, we're going to say, no, we don't own this measure. Has this measure been previously approved by CMS? Let's say yes. So what happens is you would go here and enter the existing measure ID for the measure, the exact measure ID, to help you know what QCDR measures are available for search. You can click to download here this 2024 QCDR measure specification file. And then that way you can look at all of the measures that were approved in 2024. Once you enter the QCDR measure ID here, this Find Measure button becomes active and you can find the measure. It will go ahead and populate all the fields that it's able to populate for you to at least help reduce some of your typing. Of course, if there are changes to the measure, etc., you would have to go through and edit as well. For this demo, I'm going to say no, it's not a previously approved measure. It's a new measure. So we're going to continue. And as you can see, it is a much shorter form than what the owner has to fill out because we are going to be using the owner's QCDR measure specifications as the source of truth. You would enter the measure title, who is the measure owner, and then you have to drag and drop or browse for a file, any legal documentation or documentation that you have approval for use of this measure. That can be an email from the other QCDR, it can be your legal agreement, however you have it documented. You would then drag and drop that here. Because we would expect that the owner of the measure is able to abstract the measure, we are also asking you as the borrower to attest that you are going to be able to abstract this measure, yes or no. Because the way you abstract the data might be slightly different than how the owner abstracts data. So for example, you had a hybrid approach. You could then select your own types of data abstraction. Reporting options. Your clinicians may be reporting a MIPS value pathway. You could then select MIPS value pathway or not. If you supported the measure in the past, you can, we highly encourage you, if you have any data for that measure, we encourage you to enter that data here. If you vary slightly on how you want this to be shown as your specialty or published clinical category for the measure, you do have the option of doing that for that measure. And then finally, you do have your notes that you can add here. And then if there's any additional supporting documentation that you want us to review. I'm just going to save and close since I don't have all the required fields filled out. And you'll see here my draft grew by 1. Do you own this measure now? We're going to say, yes, we do own the measure. Has it been previously approved by CMS? You have the same options. I'm going to go with no. And now, as you see here, none of the required fields have been filled out. And so these are all, half circles, etc., until you get to that green check marks. You do have the entire form then with every field as the owner of the measure will have to be filled out. And then finally, if you co-own the measure, you can choose previously approved and search or no. Are you the primary steward? So if there are multiple owners, CMS has an internal designation, truly only an internal designation. When the measure is published all three or all two or all three co-owners, however many co-owners there are, those will all be published and listed as usually in alphabetical order, who all are the owners of the measure. But for the purposes of our communication, we do designate a internal primary steward. You would say yes or no. You would indicate your co-owners. We do ask that you separate multiple co-owners with a semicolon. Since this is an owned measure, you do have the larger form to fill out, and it's considered a new measure the way we started this measure. So you'd have to go through the entire form again. There is not a way to do a mass upload of QCDR measures. So let's say you don't have any in your drafts and you're starting your self-nomination form and you have 30 measures you're wanting to self-nominate. You're going to have to add each QCDR measure separately and by using this blue button. Again, I just really want to reiterate that these all have to be submitted. All drafts have to be moved, completed, and moved to submitted status for us to consider them for the 2025 self-nomination period. All right. Thank you so much for your time, and we look forward to receiving your self-nominated QCDR measures.
Thanks, Marla. Hello, everyone. I'm going to review some resources that are available to you should you have any questions or run into any issues. Next slide, please. Okay, first off, we have the QPP website, which is always a great source of information, and we'll link you to these other tools that we have listed here. Next up is the QPP participation status lookup tool. This will allow you, this will allow you to look up your MIPS participation status. And then we have the Explore Measures and Activities tool, which will help you familiarize yourself with the available measures and activities. And just a note, we do anticipate updating both the Lookup tool and the Explore Measures tool in the next few weeks. Moving on, the QPP resource and webinar libraries are where you want to go to access a variety of program documentation and webinar recordings, such as this one, once it's been made available. The QPP help and support page will direct you to a number of support resources, including instructions on how to submit a QPP Service Center ticket. And finally, the QPP listserv is a great source of information regarding program announcements. And by signing up, you will be able to select a variety of topics that you may want to receive information about. Next slide, please. You can contact the QPP Service Center by phone or email at the number and addresses listed on the screen. Please remember that if you are submitting an inquiry via email, that you should be sending an email directly to that address rather than forwarding a previous email chain or by CCing this address. This will help to ensure that a ticket number gets created and that your inquiry is routed to the appropriate subject matter experts. Next slide, please. Additionally, important program information, deliverable information, reminders, as well as CMS training and support session invites and materials will be distributed by the QCDR and qualified registry support mailboxes listed here. Please make sure to add them to your list of safe senders in your email program. Any email address claiming to be QCDR or registry vendor support that is not one of these two email addresses is not associated with CMS or the PIMS team. And CMS and PIMS will never ask you for sensitive financial information. Next slide, please. Here's a list of acronyms that have been used in today's presentation and are commonly used throughout the program. Next slide. And that's it for me. Thanks, everyone. Back to you, Hallie.
Thanks, Dan. So we're now going to move into the Q&A portion of the webinar. For this Q&A, you can ask questions through either the Q&A box or through the webinar audio. To ask a question through the webinar audio, please raise your hand and we'll unmute your line so you can speak. We do only have a couple of minutes left, so I don't see any raised hands. So I will turn to the Q&A box. The first question we have is for Anastasia, and it reads, is AAOS a qualified registry for the THA-TKA Pro PM? Are the CMS published specifications for this measure considered CQM specs? Anastasia?
Thank you. So at this time, the self-nomination that we're discussing is for 2025. So we are not aware of which QCDRs or qualified registries will be supporting which particular measures. They could have a combination of CQMs, ECQMs, or QCDR measures. If you're looking for which organizations support which measures, I would definitely take a look at the qualified posting for 2024 out on the resource library to see for 2024. And then, of course, that same document will be available for 2025 when it is published.
Thanks, Anastasia. The next question we have is for Olga, and the question reads, for changes to QCDR measures for 2025, if they are not currently an MVP, will they be able to propose changes as part of the self-nomination? It is unclear if all proposed changes to QCDR measures are now due in April so they can go through rulemaking, or if it's just those in MVPs. Any clarification you can offer is appreciated. Olga?
Yes, we do ask that all proposed changes to any of the QCR measures be submitted during that self-nomination period.
Thank you. Our next question is also for Anastasia. Can you please confirm if data validation is required for ECQMs, CQMs, PI, and IA?
Yes, that is correct. Any of the data you are submitting is subject to data validation, regardless of collection method, participation option, reporting option, anything to that effect. Any of that data you submit is subject to data validation.
All right. Thank you all. So that's going to conclude the Q&A portion for today. Thank you everyone for your questions. As a reminder, we will be holding those virtual office hours for the self-nomination application process on August 22nd. So if we were not able to get to your question today, we encourage you to join us again in August. So I will now turn it back over to Dr. McGuire to conclude the webinar.
Thank you. And on behalf of CMS, thank you all for attending. We sincerely hope you found this educational, but we understand there will likely be additional questions. Feel free to reach out through the QPP Service Center for any additional questions. Thanks a lot and have a great day.